Okay, so last night was really awesome and I want to tell you why. Last night we had our masterclass for people who are suffering from injuries, arthritis, and even, they've had surgery and they're just not healing like they thought they would. It's a common thing, more common than you think. And we did an entire masterclass last night at CJ Physical Therapy and Pilates in Portsmouth. I'm Dr. Carrie. I led the masterclass. We talked about why, as you age, healing gets harder sometimes and it gets delayed. And there are so many reasons, which I'm not going to go into all of them here on this video, but especially for women, as we age, our hormones change a lot. We get into perimenopause and menopause, and we have to start to do things differently to give our bodies the best chance to heal. The thing I always like to say is our bodies really are designed to heal themselves. Like, our bodies are incredible, but you've got to know what's going on and you've got to get in front of things and you've got to set yourself up for success so that your body can do its thing. And let's face it, it gets harder at any age, not just when you get older, just with the way, our lives are and our worlds are and how busy we are. So there's a ton of things, everything from nutrition. You've got to make sure you're getting enough protein, okay? Because you need protein to help not only your metabolism, but also to help build strong muscles, which is the next thing, right? You need really strong muscles to age well, right? Muscles can literally act like an anti-aging natural medicine right inside your body. You need strong muscles to help yourself age well and age gracefully and help prevent things like osteoporosis, right? Then what if you have an injury, right? If you have an injury, the healing's already slowed and then you can't do these things, you end up in this vicious cycle. So that's kind of what we talked a lot about last night. When you do have arthritis, if you do have an injury, you want to make sure you can get that pain gone as quickly as possible and in the most natural way possible so that you can then do all the things that you need to do to keep yourself healthy, like stay active, build strong muscles, right? I'm walking right now. I'll use myself as an example. I'm 46, almost 47. Listen, my body's starting to change. I notice things don't heal as fast anymore either. I hurt my back a few weeks ago. Listen, I'm a back pain expert. I know what to do. I know exactly what I'm supposed to do to get rid of back pain. And I also know what I need to do to keep it gone. But even with all those tools and all that knowledge, sometimes after traveling a lot, I've been traveling a lot recently, I can still get hurt, right? But lately I've noticed, some of my, usual go-to things just don't work as well or as fast as I'd like them to. So I've been resorting to using things like regenerative therapy to help speed it along. And let me tell you, game changing, okay? I had some shockwave therapy and EMTT. Both of these technologies work to get blood flow to those muscles and help get rid of trigger points and adhesions that were literally like pulling on my bones and my back, making it really hard to move and walk and get my steps in. Because the goal here is to be able to get my 10,000 steps a day, and I want to be able to keep going to the gym so that I can strength train, and I want to keep going to Pilates so that I can work my whole body and really work on that, strength from the inside out mobility. That's my routine and I want to keep doing that. But when you've got pain, most people want to just take a rest. It was so tempting for me to take a bunch of Advil and just rest for the week, but I didn't want to do that. So by using something like shockwave therapy to help heal my tissues and the inflammation deep down into my cells very quickly, I didn't skip a beat. Within 2 treatments, I went from like a lot of pain, probably 60 to 70% improvement in just 2 sessions. And I'm not going to stop there. I'm going to keep going because I really want to knock this thing out. That's just one example of some of the tools and technology we have now to really help you heal faster, get rid of pain quickly, so that you can do all the things that you need to do for that long-term health and long-term solution. So that's why last night was so awesome, because a lot of people didn't know about this stuff. And we talked a lot about it and how it could help, how the individual therapies can help with pain and deepen your joints. That's from arthritis, right? A lot of people in the room want to know if they can avoid total joint replacements. And the truth is, yeah, you can. You can at least, you may need one someday, but you can certainly delay it and make the time where you don't need it last a lot longer. We talked about things like PRP injections and stem cell injections. While we don't do those things here in our office, the regenerative therapy treatments that we do help make treatments like that more effective. And if you do need to get something like a total knee replacement or a total hip replacement, once again, the regenerative therapy helps to prime your tissue and prime your internal environment so that you respond better, you recover faster. If you are going to have a surgery, you want it to work, you want it to last. That's what some of the people in the room were suffering with. They had recently had a total joint and it just wasn't healing the way that doctor kind of told told them it would. And it wasn't their fault. It's just they needed a little help. Their bodies needed a little help. So that's why I'm excited, because we've got things now, not just in our office, but the world is really turning on to this concept of longevity. And there's so many great cutting edge treatments out there now that we're really just trying to stay on top of, because we want to help our patients in any way we can to live their best lives well into their 60s, 70s, and 80s, okay? 60 is the new 40, 70 is the new 50. I believe that. And we're doing whatever we can in our corner of the world to really help educate people on what's out there and do what we can in sort of our orthopedic setting to help people. And there's a lot. So that's what we talked about last night. It was a really great discussion, great group of people. It was great. And I think we helped a lot of people realize they don't need to rely on things like cortisone shots, NSAIDs, Advil, things like that, Tylenol. It's not an NSAID, but painkillers. People realize that there's better ways to help their body heal and help your body do it naturally instead of doing things that go against your body's natural mechanism. That's what things like cortisone and anti-inflammatory pills do. They also learned, sadly, surgery isn't the be-all end-all sometimes, especially if you're having trouble healing from it. It can cause more problems. Scars are a big thing. We talked about that. If your scars don't heal well, that can really cause problems down the line. We also talked about how our focused shockwave therapy really helps heal scars from deep inside, that your tissue and your skin can move the way it's supposed to, so you don't get stress on joints and structures beneath. So it was pretty cool. If you haven't heard about any of this stuff, definitely reach out. As you can see, I love to talk about it. I think it's really awesome and inspiring, and I can speak personally as well, because I've been a physical therapist for 23 years now. And I've been introduced to a lot of, quote, modalities over the years. The regenerative therapy is more than a modality. It's literally a healing agent. I've never seen anything like it. I've never experienced anything like it. And I'm so excited to have this as an offering. It's really changing people's lives, and it's awesome. It's just helping people stay out of the doctor's office for things like procedures and injections, which is what we're all about. So it was an awesome class. If you missed it, make sure you sign up for our newsletter so you know when the next one's going to be. Call our office, visit our website, comment, private message us if you have questions and want to know more about regenerative therapy. All right, guys, Dr. Carrie signing off. Hope you have a great day. Bye.